Congratulations. This is the Improving Health Outcomes Award, and with me is Simon Harris, Director of New Care Models, Northamptonshire Healthcare NHS Foundation Trust, and Dr. Sachin Sankar, Clinical Lead, East Midlands CAMHS Inpatient East Midlands Provider Collaborative. That's a very long title. The organisation is Northamptonshire Healthcare NHS Foundation Trust. And with me is Barclay Phillips, Head of Strategic Partnerships, Pfizer. Pfizer is also the headline partner for the awards as a whole. Over to you.
Okay. Thank you, Victoria. So huge congratulations to Northampton NHS Trust. I think there were many strong entries in this category for improving health outcomes, but I think there were three main reasons why you were the national winner. So firstly, mental health in children and young people is such a significant issue and increasing day by day. And we know that the service across the UK is really quite fragmented. And obviously you saw that as well. And so we were really impressed by the fact that you saw a situation of huge unmet medical need and delivered a transformational change to the pathway. So that was the first thing. The second thing was that what we could see was really strong, compelling evidence of improved outcomes from what you have done. And that's not only improved outcomes for the patients themselves, but also improved outcomes for the whole system pathway as well. So there's NHS benefits as well as the patient benefits. And then the third reason was the sustainability and the scalability of this model are not only theoretically, but actually we can see from the data that this model has now been transferred to the West Midlands, and also you've become an NHS England exemplar for scaling potentially across the entire country. So for all of those reasons, absolutely fantastic. Many congratulations.
Yeah, well, high praise indeed. I want to start at the very beginning. Just explain exactly what it is that you're doing.
Well, the Collaborative is a group of organisations.
Let's see if you grab those.
The Collaborative is a group of organisations that have agreed to work together for the benefits of children and young people. So we're able to work more closely together, bring clinicians together and families together, so the entire pathway is a lot easier and simpler for children to navigate.
Maybe if I start even further back from there, what was the problem?
Yeah, sorry, can I take that? Yeah, so when we first started, and it still exists in some other parts of the country, unfortunately, where, the need for mental health in children has gone up many-fold. It's not 10, 20%. It's gone up like 5-6 times. It's 500, 600%. And as a result, when it came to the most seriously affected, the inpatients, we were having to send, like we are in Northamptonshire, which is in the Midlands, bang next to Birmingham, in case people don't know. And we were having to send children out to Glasgow, to Devon, because we couldn't find any beds. So the challenge was put to us to work together as a group to keep all our children in Northamptonshire. And at that time, the need for the inpatient beds, the length of stay, etc., everything was growing exponentially, and we were just afraid that we would run out of resources. So we came together as a group, and I think the most important thing here is teamwork. We were able to bring down our length of stay by 60%. We don't waiting list, which used to be like, children who are seriously schizophrenic, psychotic, used to wait 30 days to get into a bed. I don't know how parents manage. It used to, almost make me weep. And today, the long length of stay is 7 days for an average case. But in an emergency, we can do it overnight. We do have the beds to do that. So we have come to a stage where it's like a hotel. We have beds available for children. So if you were in our region, not you. You're too old, sorry.
Thanks very much.
But, you know, if there's a child in Northamptonshire and it was an emergency and you called us on Saturday at 7 o'clock and said, look, this child doesn't have anywhere to go, it's absolutely do something now, I can say, okay, we actually have beds in 3 places, you know.
I have literally done stories on a child who was moved from Nottingham to Edinburgh because that was the only bed. So the importance of it can't be overstated. But I'm always interested when I hear about, you know, teamwork and collaboration, because one's hope is always that teamwork and collaboration is happening anyway. But there's something else above it, isn't there? More than this.
Yeah, absolutely. Yeah. So what we set out to do was change the culture and the way people
And that's
think.
no easy thing to change culture.
No, incredibly difficult. It takes time, and we're still on that journey. But I think we've changed the culture. People are now actively working together, support one another, whereas previously it was fragmented, as Dr. Sankar describes.
I just want to read out, in case anybody hasn't seen it, there is a quote here from one of the young people in Northamptonshire who said, "They made me smile when I thought I could not. They were my saviours." Well, that alone means that this is a vital service, doesn't it?
Yes.
How do you see the future?
So I'm going to say a really crazy thing. So the challenge for us, you know, they have done this in 5 years. So if you ask me what do I want for the next 5 years, I don't know if we can achieve this. I would like there not to be any child in a hospital with mental illness, you know, with at least for in a general, you know, it's a tiered system. So we have intensive psychiatric care, and but we have a GAU level. It's a general adolescent unit. I would like to see all the children admitted at that level to be taken care of at home with their parents, supporting their parents to look after their children, least amount of disruption, you know, going to their normal schools, supported through their normal schools. That's our vision for the future.
Simon, as director of new care models, and where I've said this before, but you know, when you're hearing about innovation, what it requires is somebody like you and your bosses to be able to see the absolute value of this. And right at the beginning, it might have been hard to understand what the value might have been.
Absolutely. So we brought it all the way back to the child and the family. We put those at the centre, and we used a patient story, an unsuccessful patient story, as the starting point. So we knew what we needed to fix, as Dr. Sankar's described. Where we want to go to is another ambition beyond that, to even stop children being admitted to hospital.
Well, I mean, given the pressure on mental health services, which we all know, and particularly on CAMHS, I mean, this has you can see untold value. And other regions you think can use this model?
Yeah, definitely. There's no reason why other regions can't use the model.
Well, except they may not be as collaborative as you've shown to be.
You see, the thing about culture is that we didn't start off with this. This is not our starting point. We didn't say, oh, we have a fantastic culture. How can we use it for our children? We said, our children need us. How can we do it? And we have to start with culture. And you know, in praise of Simon and our non-clinical bosses, if I can say, although Simon is a clinician, you know, is that, believe it or not, when we were doing the pathway as clinicians, the challenge was what will you do to help? Nobody ever used the word money to us, like, you know, it is there, but we delivered it within the package. And at this moment, like last year, I think, Simon, was it 10 million that we were underspent by? So, you know, so not only clinical movement, everything comes from just being focused on the child. That's it. You know, it's the child first, second and last, and that's the culture. And once you once people are convinced, I must say, like as Simon says, it's the difficult thing was to establish your bona fides. But people who are in the NHS, they are in the NHS to help people. That's what motivates them. Despite everything that goes on, we have such a dedicated group of people. My nurses, I can't praise them more. They work from 9 to 9, and then if a nurse doesn't turn up or is late, they stay back, and their children are waiting for them at home. They're looking after other people's children. It's just amazing.
Yeah. Well, it's heartening to actually see this, because too often the rhetoric around children's mental health services has been very negative, and it's wonderful to see that actually things can change, and I'm really, really impressed, as I keep saying, with all the awards, but thank you so much and congratulations.
Thank you so
Thank
much.
you.
It's such an honor to meet you. Thank you.
Thank you.